So here's a quick timeline. So back on March 12th, the governor closed schools in 3 counties. North Shore School District had already decided to close themselves when they had several infections that turned up in their school. And very soon after, the next day, he decided to extend the closure by executive order under his emergency authority till June 19, which was effectively the end of the school year. During March and April, OSPI issued various guidelines. They had placed priority on delivering school meals, on finding childcare, particularly for essential personnel. They issued guidelines related to continuous learning, how to deliver special education, and the use of school facilities. The State Board of Education approved emergency rules related to graduation requirements. Department of Health issued guidelines on childcare. The Professional Educator Standards Board approved emergency rules related to teacher prep. During May, there were further guidances issued by OSPI, and Department of Health issued guidance on graduation ceremonies, summer camps, and there were addendums by the added through the Labour and Industries Department on worker safety. During May and June, OSPI convened various stakeholders on school reopening, and that led to a governor proclamation. So the goal was to do it before schools actually ended the school year, so they had plenty of time to plan. And he issued a new proclamation that schools must not open for face-to-face teaching in the fall unless they meet the OSPI, Department of Health and Labour and Industries guidance that was issued on the same day or soon thereafter. And Lacy will no doubt be giving you more details on what's actually in that health and safety section of the guidance. Then we're looking towards mid-August when school districts must submit reopening plans to OSPI for approval. So many of you might be involved in your local school district planning processes. So I've really covered it in the timeline there. Just many school districts across the state, the second bullet there, have already made this decision to start school in the fall in a mainly distance learning, remote learning model. And most are making exceptions that some learning will be delivered on sites for students with certain types of needs. It's anticipated this would be a small number of students, but students that absolutely cannot have their needs met through distance learning. And those who are furthest from educational justice might be included in those groups depending on the district. And that is supported by the governor and OSPI. And for any special services, that are delivered within the school building, they should be delivered using the health and safety guidelines. So there are ongoing issues to address. OSPI has held, the work groups that they held, some of them are continuing to review additional issues and continuing to get more detailed guidance out related to facilities, nutrition, transportation, ensuring that there's health and safety in each setting, regarding teaching and learning. So in this sort of environment, how do we ensure that learning is equitable? We know a lot of our students don't have internet access. How can we improve that? Schools need learning software, students need devices, educators need to be provided with professional development in how to use the various instructional modes effectively, and also what are the best methods for special ed students and other students with specific needs. Regarding policy and finance, there may be a need for statute changes in the coming session. We've seen emergency rule changes and some permanent changes from some of our state entities to address the COVID issues. We may need to see changes in budget and related statutes, for example, in transportation. So there's a ridership requirement for bus drivers, and that's important for bus drivers to stay employed. So we're looking to see what we can do through executive action, if at all possible, to preserve those jobs. Also, instructional hours, that's been looked at by the legislature. The State Board of Ed has already made changes to create greater leeway in allowing for the distance learning modes to be included as instructional hours. Additional issues are workforce capacity. If we have a hybrid model, you know, this doesn't create a need for less people, educators and paraeducators, but actually more people. We also have quite a high portion of our staff who are medically vulnerable and would be better off not doing face-to-face teaching, but redirected to settings perhaps where they can support students remotely. Also, if we have a lot of students doing remote work and parents need to go to work, we need to address their childcare needs. And if students are expected to be doing schoolwork while they're at childcare, that's another issue we need to address. So that's really just a quick overview. It's interesting at the Governor's office. People are begging to be told what to do, and then once you tell them what to do, they say, why did you tell us to do that? So careful what you wish for, but we are doing our best and we're trying to listen to you as much as possible. We appreciate the work of PSE and Rick and Charlotte, and our ears are open to your input. And with that, I'll hand it over to Lacy.
Would you like me to ask the question that's addressed to you first?
Oh yes, is it in the chat or where is it?
Yeah,
Q&A?
I will read it, is what we are doing. I think that we forgot to get that to
Oh,
you.
ridership requirements.
Yes, so can you explain ridership requirements for bus drivers to remain employed? Does this mean if students aren't being bus drivers would be at risk of being furloughed?
It does, but we're certainly looking for ways that there's a statute that requires that it's based on the ridership of the previous year. And I can get you that statute if you want. So we might be looking to see if we can waive it. However, the governor's under his emergency powers, he can only waive it for 1 month. So we're looking at other ways to preserve. It's really about apportionment to schools, and the apportionment is based on ridership. So this is a little detail that's in statute and that we need to address. I don't want to create too much fear or worry, but I do know the governor is very concerned about this, and he wants to ensure that when students do come back to school, they have buses to take them to and from school. And also there might be other ways to address it through, you know, delivering meals to students and delivering, you know, doing other sorts of deliveries. So that's something we're looking into, and if anybody's got any ideas about that, please let me know. What about recess? Not sure what you mean by that. Like, could somebody clarify that question?
I think that might be more of a question for Lacy, Maddy, when we talk about the
okay.
of the students at recess.
Okay.
Okay. Thank you all. Thank you, Maddy. I want to start off, as Maddy did, thanking you all for everything you have done to support your students, your families, each other, your school community, your neighbors through this really challenging and uncertain time. I know that professionally and personally, it has required patience and sacrifice and innovation. And, you know, we have we're 6 months into this journey in Washington State and globally, and maybe 7 months globally, and we have a ways to go. It's not easy. We know that, and want to remind people that the last time our country, our state, the world went through a pandemic of this size and impact was more than 100 years ago. There have been some more recent pandemics, but in terms of scale and scope, 100 plus years ago, society was very different, and certainly schools were very different then. Our approach to this has really been to lead with the science wherever we have it, and recognize that the science is going to emerge and evolve quickly over time. And we'll talk a little bit about that here this evening, and that we continue to learn and adapt based on what comes out in the literature, what we see happening in other states or countries, and do our best to protect children, families, and communities as we go forward on this journey together. Okay. So what have we learned from countries that reopened schools? There are three common themes among many countries who opened their schools, even if briefly, at the end of their school year last spring, early summer. One is that most countries that opened successfully, and when I say successfully, I mean they didn't have like a rash of outbreaks in their schools, or there wasn't suddenly a massive uptick in community transmission. So they had a downward trajectory of disease in terms of COVID cases in their country, and they had generally low rates of COVID in their community. And one of the ways that we report this in public health is the number of cases over a period of time. And the reason we do a period of time is that's a little more stable than day to day. You can see a lot of variability in day-to-day numbers. So many of the countries that opened in the spring opened with fewer than 25 cases per 100,000 over a 2-week period. Some had even lower than that. The third common approach is that most of these countries brought back some of their students, not all of their students. So some might have brought back their youngest learners, like our equivalent of elementary school. Others brought students back who had exams that were important for them to move to the next level of school in their country. Some brought back children of essential workers or children with special health care needs, but most did not bring back all of their students at once. And then the other piece in their cautious approach is that they implemented health and safety measures and layered them. And there's a variety of health and safety measures that different countries took. We did draw on many of them, most of them, in terms of informing our guidance, and I'll come back to that a little bit later. What have we learned since then? We got a report from a group here in Washington State called the Institute for Disease Modeling, and they've been helping Washington State with our response on a number of issues. And I want to point out that they're using data that we have had to date to sort of project what we might see in the future. And it's a model. So it's an estimate for the future. It's certainly sometimes wrong, but a good way to help us inform our decision making. So a report that they released earlier this month focused on schools and the impact reopening schools would have potentially on disease spread in King County. And they did hone in on King County data and looked at what school. They looked at different mobility levels in the community. So 70%, 80%, 90%, and 100. You can see those on the shaded bars. And so that's just general public moving around. And those are compared to pre-COVID rates. And for context, in early June, as our state began reopening, our mobility rate was around 65%. So they looked at different ways of opening schools in King County. So for example, with health and safety measures, or they show up on this chart as NPIs, which stands for non-pharmaceutical measures. With those non-pharmaceutical measures, including cohorting and symptom screening, and then layering on community access to different levels of testing and contact tracing in the community. And they compared that to having no school. Something I want to call out on this model is they have to make assumptions to do their modeling, and in this model, they're looking at a full return to school, all learners 5 days a week. We are expecting updated models that look at the hybrid options that a lot of school districts are returning, but this chart is really showing us predictions of what disease spread would look like with a full return to school. And without any countermeasures, the number of new cases in COVID, new cases of COVID in King County would potentially double over the 3-month period in the fall if we go back to school as we did last September, for example. However, if we group students, use cohorting, as we call it in public health, physical distance, wear masks, increase hand hygiene, we actually could potentially open school without significantly increasing the levels of community spread. And you can see that best in particular at the 70% mobility level on the bars that show some level of testing, whether it's 25, 50, or 100%, and contact tracing. So it is important to note that at nearly all mobility levels, the effective rate of the virus, the reproductive effective rate, which is really telling you how many people a person with COVID goes on to infect with the disease, it decreases as countermeasures are added. And you can see that, looking left to right on the chart. And then it also decreases as mobility goes down. And you can see that looking within a set of bars going right to left. So the good news here is that the guidance that Department of Health released in partnership with the Office of the Superintendent of Public Instruction and Department of Labor and Industries includes all of the health and safety measures that were featured in the modeling. And we did pull these from countries that had successfully reopened. So specifically doing symptom screening and monitoring. And this is really the goal here is helping people stay home when they're sick, to do cohorting or groups, to provide 6 feet of physical distancing, to require the use of face coverings, or for people who cannot tolerate a face covering, that they use either clear face coverings or face shields, and that we work to increase hand hygiene as well as environmental measures like increased cleaning and better ventilation in the schools. In addition, we are doing some updates to our guidance to add some clarifying language and address a lot of the frequently asked questions that we're getting, as well as to align with some national organizations that have released recommendations since our guidance came out. There aren't substantive changes in the recommendations. It's really more adding specificity, where we have added additional guidance, and this is not published yet, but we're adding a section on how to handle cases and outbreaks in schools, a little bit just to help schools understand their role in partnering to do testing and contact tracing. And before anyone gets nervous, I want to say, ultimately public health will be doing those 2 jobs. We just want to make sure schools have the pathways to link their students and staff and families to testing, and also that schools can help support local public health in doing contact tracing when necessary. And then also guidance on how people return to school, and that's whether they're staff members or students after they've had symptoms that excluded them, after they were a close contact of someone with COVID or had an exposure, whether that was in the school or elsewhere, and if they did actually have coronavirus. So this is the second part of sort of how we look compared to other countries and what the modeling has shown for us. And one of the questions that Rick sent me was, we were all excited about opening in June, and the guidance really came out to, sort of give schools the tools for how to open, assuming we would. And by open, I'm referencing if you're providing in-person learning. So the difference is, as our state opened up the economy, we saw, and we expected to see some increase in cases, but we saw a rise in cases over the month of June and into early July. That has resulted, as I'm sure you're aware, in us changing some of the activities or thresholds or occupancies of things that are allowed as part of reopening. And the good news is that we are starting, we think, to see a plateau in our case counts statewide. However, our disease rates for COVID as a state are pretty high still, so we need to do a lot of work to bring them down. Our current case count over 2 weeks, and I referenced that earlier, is a bit more than 135 cases per 100,000. It's up there on the bottom chart. And most counties are not meeting our state's goal for what we call low transmission, which is 25 or fewer cases per 100,000. Those are, you can see them in the blue, light blue, or gray shaded areas. I think we have 3 right now. This chart might seem alarming. I want to remind people that a lot can happen and a lot can change in a pandemic in 4 to 6 weeks, as we know from being previously just now on the front side of this curve. So, in mid-May, there were several counties meeting these measures. So I really want to encourage people to take the hopeful approach. I think my key messages are that reopening schools, and this is really true for any community setting. This came up as a question earlier in the day, like, what about long-term care facilities? It's true for them too. Any of these settings where we bring people together for periods of time, they can't be considered in isolation from the communities in which they exist. The children who go to school, the staff who work in the school, all go back to families in their community. And so what happens in the community impacts what happens and is just as important as what happens inside of the school. We have a lot of work to do as a state and in our communities across the state to really drive down transmission of COVID so that we can provide more in-person learning opportunities for children and also keep our economy open in Washington State. And in order to do this, we really need help from leaders and the public in really staying home when we're sick or just staying home as much as possible, really minimizing our non-essential trips out. And then when we do go out, that we wear our face coverings, keep our distance from others, and focus on shorter, fewer, and safer interactions. So that's gatherings. Risk for transmission goes up based on the number of people you come into contact with and the duration of those contacts and the different mixing. So, think about your life and your circles, and all of those things add risk, increase risk. The more interactions you have as part of your professional life and your social life contribute to the risk for community spread. So we're really trying to help people understand that fewer, shorter, safer interaction piece. And that's largely what drove some of the recent changes by the governor and our secretary around reducing gathering sizes. So with that, I will stop and I think we'll go to questions.
So we have a question from Carly Jackson, and she states, we know temperature checks are not effective screening for SARS-CoV-2 infection, and pre-symptomatic individuals transmit the virus. What screening tools would be effective for screening? What protection would you recommend in place for bus drivers? And what would you advise we advocate for if a driver decides a student is not safe to transport?
So one thing I want to say is that the community mitigation measures, the ones that we've outlined, the symptom screening, the hand hygiene, face covering, distancing, and then the environmental measures to increase cleaning and ventilation, they layer on top of each other because none of them on their own are 100% effective at stopping transmission. They all reduce transmission or they reduce the number of close contacts that you have in the case of cohorting. So symptom screening, the goal here is to catch people who do have symptoms, whether that's a temperature or some of the more common symptoms of COVID, and really encourage them to stay home. The other piece that we have heard from schools and childcares is that having that symptom screening, in and of itself reminds parents and caregivers and staff, in some cases, that times are different and we have to be really mindful of this to protect our own families and our neighbors. And the other piece is that actually having that required screening does help when we have to send students or children or staff home, and there's a reluctance or some argument potentially about like, well, this is just a little cough or whatever the case may be. So, I hear you on the concern, and as we saw in the modeling, the addition of doing the symptom screening does actually help some people who have COVID be excluded. It does not remove all risk, but for example, the asymptomatic, that is a large driver for why we require face coverings. In terms of bus drivers, I think, we require face coverings on the bus. We recommend increasing the ventilation on the bus to the degree possible, whether that's windows or the air system. We do recommend providing physical distancing between the bus driver and the riders, and the riders to a degree, and then among the riders to reduce risk. And you'll see this in the new guidance or the updated guidance when it comes out. We recommend assigned seating and seating people either with their household members, so siblings, or their cohort members, classmates.
Okay, we have another question from Claudia. When you are looking at cases, does this just mean those with symptoms, or does this also include those who test positive but don't have symptoms?
The cases I want to make sure I understand the question. The cases that you saw on that epi curve that I showed here is anyone who has confirmed COVID, whether or not they have symptoms. And when we talk about excluding people from school because they have COVID, we would mean any person who is diagnosed with COVID, whether or not they have symptoms.
Lacy, I have a question. Since the mask mandate went into effect, can you speak to how we're doing as a state and if you're seeing any evidence to support the effectiveness of that mandate?
We are seeing increases in compliance with mask wearing since the orders have gone into effect. We actually saw this first in Yakima, where they had a local health officer order, and then the governor's business order went into effect first. And they have actually now before any of those orders, I believe they were around 35% mask wearing, and they're north of 90% now in Yakima. We are seeing increased mask usage statewide, and we are, it does correlate to the slowdown of our spread when you look at this epi curve. I think, you know, we're cautious to say the mask wearing on its own is solely what's driving it, because we've made some other changes as well, but we do see some promising signs that mask wearing is helping. And the other thing, you know, we are seeing more articles published in the literature, and one really great one that came out was about 2 hairstylists that both had COVID and exposed dozens of people in theory. They had dozens of clients, and none of those close contacts ended up getting COVID. They were followed over time. So we are seeing increasing evidence that masks make a difference in terms of preventing droplet spread and transmission of COVID.
Okay, we have a question from Carly Jackson. Have there been studies on how to improve NPI in children within educational settings? And what resources do you recommend for ideas?
That's a great question. I don't actually know if there are studies. What I have seen out there really are more about just typical ways we support children in adopting behaviors. So, you know, being patient with them. You all are experts on this. This is what you do for a living, being patient with them, making it fun for them, making it engaging for them, not like being positive about it, messaging to them that they are, you know, helping. So, you know, physical distancing is particularly challenging for young children. Some guides that I've seen have encouraged kids, like, basically, you know, for an adult, a good way to measure 6 feet of physical distancing is your arms like fully stretched out. And the people near you, their arms would be fully stretched out. But you can do things like markers on the floor, or for circle time, you know, little spots that they sit on, those types of things. For face coverings, this is a lot like learning to wear clothes and shoes. Now we start babies with that, and I don't actually face coverings are not recommended for children under 2, but things that you can do, start with short time periods of mask wearing when, and this is really for their parents and caregivers, when we're going out to run errands or take a walk around the neighborhood. Make it fun for them, let them choose their mask, let them decorate their mask, let them try their mask on their baby dolls or stuffies. Be very positive, again, and really praise them for helping to control the spread of COVID and protect their neighbors and family. Those are a couple on the, I think those are the 2 harder ones. Hand washing, I think elementary schools, my experience is they do a great job teaching kids to hand wash and supporting that hand washing and hand gel behavior. We get a little lax with older kids. I think they're going to need some reminders this school year. But those, I think the face coverings and the physical distancing are probably the newer ones and harder ones for our young people.
Okay, thank you. We now have a question from Kathy. How many of the COVID cases were children under the age of 19?
That is a great question. I can actually look this up and show you, I think, where you can look it up. Give me 1 second. Okay, I'm going to try this. All right, are you seeing a dashboard that looks like the Department of Health website?
Yes.
Okay. All right, so when you look at this dashboard, there is, going to go a little slower since we're on Zoom. There is a tab called Demographics. And we can see cases by age group. So of all of our cases to date, 12% have been in children 19 or under. And this dashboard gets updated every day, usually around this time of day.
Thank you. We have another question from Laura Rogers. Today, Snohomish County stated that schools would be virtual due to the increase in numbers. How does that relate to what you were saying today?
So I think that correlates closely with some of the key learnings we've had about countries that reopened successfully or more successfully, that when disease rates are high in the surrounding community, that increases the challenge of opening schools. And I'm trying to actually quickly see what Snohomish County's rates are. But I am guessing that their health officer, I will not speak for them, but their health officer and superintendents decided that the community transmission in the surrounding area was high enough that the wisest choice at this point was to start in a virtual environment while they work to bring down their rates in the surrounding community.
Okay, we have a question from Marcia Pearson Johnson. Are there specific detailed plans for keeping staff and students' restrooms distanced and hygienic? She's only heard about plans for classrooms and cafeterias.
So we have general cleaning guidance. I think in terms of distance and restroom, I haven't seen a specific school plan, but what I can generally tell you about other sectors that have opened and even our building here at the Department of Health is sometimes you can put a sign on every other stall to make sure that there's or urinal in restroom for people who identify as male. So there's space among people using those facilities, and you can also put markings either with tape or spots or cones where the queue for the restrooms are.
Thanks. We have a two-part question. What is the best method to test students and staff? Our district will check temperatures of students and staff. Do we check as they get on the bus? Do we check them as they arrive on the school site? And then also, if someone leaves the state, will they have to quarantine when they return?
Okay, I'm gonna answer these in reverse order. Currently, there is not a state requirement to quarantine when you come home from out of state or out of country travel. I would generally say that the Centers for Disease Control and Prevention, our federal organization for public health, has a global travel advisory related to the pandemic and considers it a good practice to quarantine to the degree possible when you move from jurisdiction to jurisdiction. So that includes when you go on your trip and potentially if you come back. On the first question, person said test students and staff, and I think they meant the symptom screening. So I'm gonna answer that, and if they actually meant the diagnostic test, then circle back with me. There are multiple ways to do the symptom screening. One, we do recommend the temperature check, and then in our guidance, there's a link to the common symptoms, and they're also outlined in the guidance for COVID. So you're asking people if they had those symptoms that aren't attributable to another cause, if they're a known close contact of someone who has COVID. So that would be, is there a person in their household that has COVID, or have they been informed by local public health that they're a close contact, or do they otherwise know that they have been in contact with someone who has COVID? And if they meet those criteria, we want them to stay at home. And then there's guidance for how they come back. In terms of best methods, like we have essentially in our guidance said we think it is important to do this daily. We are leaving pretty wide discretion for schools to figure out how to do this in a way that works best for them. There are options. One is the option for parents to do this at home and sign a form or submit something to the school that shows that they did. It can be done before the student gets on the bus. It can be done at the front of school. It can be done as the students come into the classroom. We have a lot of flexibility there. The idea is for it to happen relatively early in the day and once a day, so that when people have symptoms, they are excluded in a timely way. And you've heard me say the word close contact, so I think I should probably also define that. For COVID and for the disease investigations that HELP does, we typically define a close contact as someone who is within 6 feet for 15 minutes or more. And that's when we would ask you to quarantine if you are a close contact of someone. And so when we and you can see how that informs our guidance and why we're recommending 6 feet of distance in a classroom and as much distance as possible on a bus, and that we do the symptom screening early in the day.
Thank you. Our next question comes from Gail. Gail says, I'm a paraeducator who works exclusively with the nurse health room and worked at 3 to 4 different schools each week, all grade levels. I'm very concerned as I'm turning 65 next month. So in addition to be in the at-risk category due to age, I'm also at risk being exposed traveling to different schools. Any suggestions?
That's a great question. So we are encouraging schools and all sectors, not just schools, to have plans for protecting people who are at risk and their employees who are at risk, whether that's due to age or other underlying health conditions. The other piece I will share is that for people who have job types where the physical distancing is harder to do, or where the students that they support are less able or less likely to be able to wear face coverings, or if they are in a place where they are likely to be dealing with potential students or staff who get sick at school, then L&I, Labor and Industries, is working with the Office of the Superintendent of Public Instruction to come up with some guidelines for the appropriate personal protective equipment for those types of employees. In terms of going from school to school, I think to the degree we can, and this is hard, and we know that a lot of the health staff especially, and nurses especially, are shared among schools. To the degree that we can minimize the number of people in each of those schools that we're interacting with, that is helpful. And beyond that, it's using those, robustly using those non-pharmaceutical interventions and community mitigation measures that were mentioned, along with the use of personal protective equipment where appropriate.
Thank you. A question from Diane Carter. is she has read that we don't have enough PPE or testing capability to safely reopen in-person classes.
So there have absolutely been supply chain issues and will likely continue to be some level of supply chain disruption as we go through this. In just context, every country in the world is dealing with this. I will say on the personal protective equipment front, there has been some good progress on the supply chain in our experience, both at the state level in securing supplies for the state stockpile and the PPE that we provide to counties and local responders. And we're hearing similar from our hospitals. It's certainly not perfect, but it does seem to be improving. On the testing side, we as a country and Washington State faced a pretty rough May and early June. We have broken through the supply chain issues on the sample collection kits. Those were the swabs and that they use to take the sample from your nose, and the transport media that the swab goes into and heads so it can be sent to the lab. We are feeling pretty good about where we are on those supplies. We're running into some issues on reagents for some of the testing platforms, but we are definitely still having good capacity within our labs in Washington State. There are some delays in testing, and that has, that it is associated primarily with national labs that are serving not just Washington State, but other states that are having even much larger surges in cases than we are. So like it is an issue that we're working through. I think on our sort of planning tools that we're giving to locals and to schools, we are recommending that they have plans for figuring out test levels of testing and contact tracing, and that factor into their decision to reopen. So can you test and trace in your community to manage the level of spread that you have? And we are exploring some ways or tools to give to schools so that when people have symptoms, whether it's a teacher or staff member or a student, we can point them to where and how to get tested. And both of those things, like testing and contact tracing, both of those things are increasing in terms of capacity and availability statewide.
Thank you. We have now a question from John Capel. Do we have any recourse if school administrators do not wear masks or do not enforce them with employees and community members?
That's a great question. There is a way the Secretary of Health has an order requiring masks indoors and outdoors when you can't maintain 6 feet of physical distancing. And there is a way to file a complaint, so that could potentially be an option. I don't know if there is a specific pathway within the school world. That's not my area of expertise, but I'm happy to take down that question and see if OSPI could address it.
Thank you. Our next question, whoops, it just scrolled. Hold on a second. Our next question comes from Edward Angelbeck. Do these requirements also apply to private schools and preschools in our state?
They do apply to private schools. Preschools are in the childcare portion of the guidance, so that's different guidance, but generally it's the same health and safety guidance, although there are some differences that I think Lacy could address for you.
Yeah, I think the biggest difference for preschool is that the masks are not required. They're preschoolers may wear them, but they're not required to wear them. And you know, we're pretty clear that physical distancing is going to be a challenge in a preschool. We do recommend that preschools try to achieve it, but acknowledge that it's, you know, they're going to be moving around the room and around outside a lot.
On the question of complaints about mask wearing or contravening other emergency orders, there is a location on the governor's website where you can fill out a form. We're getting hundreds of complaints, so it is taking some time to get through them. We do hope to answer every complaint. We may be sending them to OSPI to help answer complaints for us. It is considered a misdemeanor to go against an emergency order. However, we don't have enough capacity in our law enforcement to be able to follow through on every contravening of the order.
Thank you both. We have a question from Nancy Hutchinson. Why don't we have more public service announcements? We need the public to truly realize we need to work together. Basically, schools won't open if we don't get this in control.
Thank you for that question and observation, which I appreciate. We are actually, we recently expanded a media campaign we have around masks. You might see, depending on what social media channels you are on or what television outlets you watch, you might see some of the Mask Up Washington campaigns, and there are some locals that we're aware of doing some of this messaging. The other thing that we've really asked leaders to do, whether that's local elected leaders, school leaders, other business leaders, it is sort of be the model, be the mask ambassador, as someone said. And that goes not just for masks, but also some of the other things we're asking, like minding your distance, and also really focusing on fewer, shorter and safer interactions in terms of gatherings. I can share that my daughter's birthday was yesterday. I have 2 children, and she is my social child, and she had a birthday party with one friend and the friend's parents, and it was outside and we had distance, because that's the types of choices we have to make in this challenging environment we're in.
Thank you. This question comes from Jill Ziegler. Is it likely that RCW 28A to 10 regarding vaccine exemptions be amended for any potential vaccine for COVID-19? How will the DOH address medical exemptions?
Thanks for that question. If we were to amend rules around school vaccinations, that would go through the Board of Health. They set the requirements for school mandated vaccines. And then, in terms of medical exemptions, the process would be similar to other vaccines, I would expect. I have no ability to guess when a vaccine would become available. I don't think the board would take an action until we, get closer to that phase. And, I do expect that when the vaccine becomes available, as with other pandemics like H1N1 10 or so years ago, there will be some limited supply initially, and we will have to prioritize who gets vaccines first. And I do know that our team at DOH has already begun conversations with the Vaccine Advisory Committee and stakeholders about thinking through what some of that prioritization might look like in preparation.
Thank you. We have a question from Elise Maffeo. Is Washington State considering requiring people coming from states with very high rates of transmission to quarantine, as New York has implemented? Why have we not done this yet?
We are looking at pretty much every option we can to control the spread. It is on the table. I think we have focused on where our data are showing us most of our cases are coming from. We certainly see some from travel, but we've seen a lot recently from gatherings. And so we've really been focusing on the gatherings and minimizing and reducing the risks associated with gatherings.
Thank you. A question from Tracy Bode. As for students with special needs, are there health requirements for students that may run away from a structured environment? Who is responsible for contaminated areas that may be unknown?
So, I think for children with special healthcare needs, first of all, their family individually should be consulting with their healthcare provider about their risks for returning to school. In terms of the cleaning, disinfecting question, we do recommend that anytime there is a student who potentially had symptoms, that the school does its best to close off the areas where that child was or staff member was, and then follow the cleaning and disinfecting protocols that are outlined in the guidance. I think the responsibility question probably is more for an education expert than for me.
Thank you. We'll have this be our last question for the night. He says, I'm a job coach for young adult students and have to take students to a job site by using a local community bus. Is there any advice how to get distance from other people and students in the bus?
Thanks. So on transportation, social physical distancing is challenging. Generally, the ideal is, every other seat at least, to the degree possible. Every bit of distance you can get is helpful. So, if you can only get 3 feet, that's better than being right next to a person. We're certainly striving for 6 feet wherever possible. That's in our guidance. My other recommendation would be definitely to use face coverings, and then hand washing or hand gel before you get on the bus or transportation, and then quickly after you arrive at your destination.
Thank you, Lacy. This has been very good information, and I believe everybody's learned something and now can access that website to get some more information. I think it's time to do a door prize. Travis, what do you think?
I think that's a great idea, Charlotte. I'm just gonna hop on here. So thanks so much, first of all, Lacy and Maddy, for joining us tonight. Really appreciate it. Appreciate your time and all the great information and some great conversation and questions. Just want to remind everyone to go ahead and look for the recording of this webinar. If you didn't get your question answered too, we're going to take a look in the chat box here, and we're going to get all those questions compiled and post them on the member portal and connect. So you can go ahead and take a look there. So we'll do our best to get to all those questions here. But I'm going to go ahead and share my screen right now because it is giveaway time. So as you can see here right now, I've got a randomizer up, random.org. And then I also have a list of all of our participants who registered. So everyone, as you can see, has been assigned a number between 2 and 397. So let's go ahead and refresh this. So 2 and 397 was our range. So when I hit generate, it's going to pull a winner, and we'll check the list to see who that lucky recipient is. But we do want to remind everyone that we do need to be here to win. So if you're not on the call, we will give a few moments here, and then we will draw another recipient. So if you are here, if you could just hop on the chat and let us know. So I will be watching that chat box here. Okay, so let's see who our first lucky winner is. And the giveaway that we are doing first is for a Yeti cooler. So I know those are really awesome. So whoever wins this is going to be pretty lucky here. So let's see who is the recipient of that Yeti cooler. 325. Lucky number 325. 325 is Marsha Lundy. Marsha, are you on the call here? I'll give you a moment if you are to hop on the chat there. Again, that's Marsha Lundy. Do we see Marsha on the chat here? Doesn't look like it.
I don't see her on the list.
Don't see her. Okay, that's all right. Well, I guess you do need to be present to win, so let's go ahead and draw another name here. Okay, 105. Let's see here. Lucky number 105 is Lorraine Schmidt. Lorraine, are you on the call with us? Just go ahead and enter your name in the chat box and let us know. Give a few more seconds to Lorraine.
I do see her on the call. Lorraine, can you answer in the chat box there that you are here? I just opened chat up for everybody, so you should be able to do that.
Okay, again, Lorraine Schmidt. Go ahead and hop on the chat if you could and let us know you're here. Okay, want to give it a few more seconds? You said she was on?
And now I don't see her on the list anymore. Oh, she is here. She is here.
Okay, Lorraine, your last call here. Going once. Going twice. Okay, I don't see her, so let's go ahead and draw another name. Okay, 147. Let's see who is 147. Ross Wood. Ross, are you on the call?
Jennifer, sorry, real quick. I'm getting text messages and they're still saying it's disabled.
I just fixed it. Sorry.
Okay, so I see that Lorraine was here. So I think what we should do, just in the sake of fairness, since it looks like that wasn't up, Lorraine, since you were drawn for the Yeti cooler, we can go ahead and award that to you. And Ross, since you were our second winner, we do have another prize, and that was going to be a $100 Fred Meyer gift card. But just in the sake of fairness, I think we should go ahead and give you that prize. So congratulations, everyone, and thanks so much for sticking on. We'll go ahead and get those mailed to you. So be on the lookout for that. So thanks again, everyone. And I don't think, is there anything else we need to cover tonight, or are we good to wrap this up?
I believe we're good. Thank you for attending, and we look forward to seeing you tomorrow. Where, Travis, are we talking about special member benefits?
Yeah, so you're going to want to be on that call. That's going to be myself and Lauren Getson, our communications coordinator. We're going to be talking about member benefits, and we also have some special guests from SEIU member benefits to show you the whole suite of what's available to you as a PSE member. So make sure you're there and see some really cool stuff.
Thank you again, Lacy and Maddy. We appreciate you coming and helping. I'm sure that people have had tons of questions answered, and I'm sure there are tons more, but we now have 14 in the chat, so they'll get answers for them too. Thank you again. Bye, everyone.
Thanks, everyone. Have a good night.
Well.